what we know from history is that the DSM-5 had a bereavement. The bereavement exclusion, I believe, began in the 3, and the 3 gave you 1 year. Basically, because the overlap of symptoms between what would be a major depressive disorder and bereavement is, I mean, the symptoms are virtually indistinguishable from one another. So if you look at the checklist for major depressive disorder and you look at what most bereaved people experience to varying degrees and at varying points throughout their grief experience, then what you see is that such an overlap of symptoms that even the most skilled clinician would not be able to sufficiently distinguish between what's a major depressive episode and what's bereavement in the wake of the loss of a loved one. The DSM-3 gave you 1 year to have these, quote, symptoms, and then the DSM-4 reduced that, and they reduced it from 1 year to 2 months, so you could have these symptoms for 2 months before you would could basically be diagnosed with major depressive disorder. So 2 months, of course, is not enough. I mean, it's complicated. Human emotions and our attachments to our loved ones are complex. And so, I'm not a big fan of the 2-month bereavement exclusion. But then the DSM-5 basically takes it out. You have 2 weeks to have these symptoms before you can be diagnosed with a serious mental illness. This is a problem for clinicians and for scholars alike, because there is no evidence to support this move. And in fact, the data suggests that just the opposite, the reliability of the DSM-3 in terms of the bereavement exclusion and major depressive disorder was actually higher than the 4, and the 4 is higher than the 5. So we're going the wrong direction. We're not doing better. We're increasing the risk of more people who are having normal sadness, normal feelings of despair, of longing, of changes in eating patterns and sleeping. I mean, we're changing what it means to be normal. We're changing what it means to love deeply and to mourn. And this is really dangerous. Now, I will tell you that it's different. It was very, very different for me when my 88-year-old grandma died than when my 68-year-old mother died. And it was very different for me when my 68-year-old mother died from when my newborn baby died. The DSM doesn't take into account context and the nuances and interpersonal history and a historicity of loss and culture. I mean, there's so many. It's a really rather reductionistic view of human suffering in the aftermath of the death of a loved one. I haven't seen any reliable data to suggest that psychiatric medications are useful in bereavement. I can't say whether or not medications stabilize people's personalities. That has not been my experience. My experience anecdotally and clinically has been that people on medications, it might bring the bottom up, but it also brings the top down simultaneously. So the world gets smaller, and that may or may not be useful for some people. Again, what I would defer to is there's no evidence that it's effective for people who are grieving, and in fact, anecdotal evidence in some cases can show that it may be actually an impediment in grieving. That's been my experience anyway. Do I think that circumventing the normal, natural mourning process can be problematic for some people? Sure, absolutely. I've seen it clinically over and over and over again. I mean, I've worked with some, particularly women, but some men as well, who had losses 20, 30, and one even 42 years ago, and feel like they had suffered their whole life because they were unable to mourn and grieve for their child or their baby who died. I guess what I'm saying to summarize is that because there's no evidence that medication is effective for treating grief, and in fact because we have to even question why we want to medicate people. Why? Why does someone's, in a sense, personality need to be stabilized? Maybe it's the destabilization that needs to occur in order for them to gain equilibrium again. They have to find their new normal. And so in a sense, what does Rumi say? That the healing from the pain is in the pain. And I think that sometimes those 16th century Sufi poets knew a lot more than we know about human suffering and how to treat and care for human suffering.